Yeah, welcome. My name is Dr. Steve Edelson, and I'm the Chief Science Officer of the Autism Research Institute in San Diego. You're joining us today for a webinar by Dr. Carmelo Rizzo titled Food Adverse Reaction and Intestinal Microbiota. First, though, I would like to introduce Petra Dillman, who's a representative of the World Autism Organization, and she'll share with you information about the World Autism Organization. So, Petra?
Hello, good evening, everyone, or good morning, wherever you're watching from. Welcome, and thank you to the Autism Research Institute for hosting this webinar together with the WAO. The World Autism Organization came about in 1998 and sprouted out of Autism Europe when requests for help came from throughout the world, and they felt it was too much to handle just by Autism Europe, and there's space for a World Autism Organization. So the first members were people who were also members of Autism Europe, and our first president was Pat Matthews from Ireland, and thereafter it was Paul, who will also speak just now, and then came Isabel Bayonas from Spain, and Jill Stacey from South Africa, Samira Al-Saad from Kuwait, and at the moment it is myself from Namibia. So we are really a World Autism Organization. Our aims are we as persons with autism advocating for ourselves and parents advocating for our children with autism, with the contribution of professionals and friends who want to share or who do share our views. We pledge ourselves to press for the rights of the people with autism as in the Charter of Rights that was created by Autism Europe, to be enhanced and enforced by appropriate legislation worldwide. This is not an easy job, and also fundraising and assistance to various organizations and to the world are proving to be difficult because in many, many places there's still much work to be done as to not only providing services about autism, but also creating services and knowledge about autism. So our Council of Executive Administration works together or strives to work together and to network to improve the situation. Thank you very much. And personally, I'm a parent of a now 35-year-old young man, Michael, who's non-speaking, but who communicates in different ways. And also currently the bid is out for the next World Autism Organization Congress, which is to happen in 2026. So we hope that whoever is listening from an organization that you might consider to bid to host the next World Autism Congress. Up to so far, it was held in Melbourne in Australia, Cape Town, South Africa, and then in Mexico, Kuwait, and Houston. And the one in 2022, unfortunately, could not happen because of COVID. And the next one, it might be your organization that is going to host it. Thank you very much.
Okay, thank you, Petra. That was very informative. Let me say a few words about the Autism Research Institute, or ARI. ARI was founded by pioneering researcher and parent advocate Dr. Bernard Remland in 1967. So this is our 57th year of monitoring, supporting, and conducting research. More specifically, ARI funds research studies, sponsors an international support group network, and with over 260 members worldwide, as well as a science network. We also sponsor think tank meetings, publish original articles and books, and produce videos and webinars, and actually quite a bit more. But if you'd like to learn much more about the Autism Research Institute, please visit www.autism.org. So as far as today's speaker, I am privileged to introduce Dr. Carmelo Rizzo. I've had the opportunity to discuss autism as well as autism research with Dr. Rizzo numerous times during the International Autism Conference in Moscow. Dr. Rizzo practices medicine in his clinic in Rome, Italy, and has always been interested in the field of nutrition. For over 40 years, he has conducted numerous research studies in the areas of food allergies and has taught at numerous Italian universities. So I'd like to welcome Dr. Carmelo, but I know that Paul Shattuck would also like to say a few words.
I would just like to say, that I've known Carmelo Rizzo I met him in the last century. Italy is not the easiest place for people to study autism. They still have some fairly old-fashioned views there. And Carmelo was a rebel. I hope he doesn't mind me saying that, but he continued with his studies, and in many ways he's been shown to be right. The only thing in which he's wrong is supporting a very poor football club. There are much better football clubs than that in Italy. But anyway, I will leave you with that. I'm sure you'd rather hear Carmelo speaking than me anyway. So thank you very much for all that you've done over the years, Carmelo. We're very grateful and look forward to hearing what you have to say now. Thank you.
Yeah, okay, thanks, Paul. And Carmelo, it's your turn now.
Okay. Of course, I want to thank Dr. Petra Dillman first, because she started the World Autism Organization, which I put here on the slide, the middle there, as the most important sign that I want to show, together with Steve Edelson, which I know for the past 12 years. Steve, if you remember, we met in 2012 in Moscow the first time. And then I involved Paul, which I knew many, many years before, to come there for the first time with me. And then we cooperated all these years. I'm not a neuropsychiatrist. I'm not a teacher. I'm not a therapist, but I'm a nutritionist. I define myself a clinical ecologist always. And I took always into consideration the environment and mostly the food and the food adverse reactions, which can cause many, many diseases. And I saw that when I changed the diet, first, as it was taught by Paul and Reichelt about the casomorphine and glutamorphine theory about the neurotoxins that neuropeptides, which were involved in this type of syndrome, then I had to dig into the problem again and again in everyday life. And we had to give answers to parents, to therapists and teachers what to do with children which suffer from ASD and also other syndrome like Rett syndrome and Asperger, ADHD, and so on. And so that when we modified the daily nutrition of these children and we avoided many, many foods, then we saw some changes. And this was a hint for us that we must investigate more and more about food intolerance, which we will see through the course of these slides. But this alone didn't make any difference if we didn't take into consideration the intestinal microbiota and the intestinal flora, so that we had to study and investigate in the gastroenteric syndromes alongside with what we spoke about in ASD. And so we start to consider that our state of health in general, or in all of us, this is influenced by many, many items, starting from nutrition. But then we had to take into consideration the chemicals, the inhalants, because many children were asthmatic or they had ocular rhinitis, they had stuffy nose or asthma. And so inhalants were involved in this, like dust mites, like cat and dog dandruff, and also airborne allergens in general, trees, herbs, and so on. Then we saw that even emotional problems were a big problem. Infectious disease, ear infection, and repeated infection, which were simple bacteria, but sometimes we had viruses, and so we had to take into consideration the repetitivity of the infectious disease children. So that poor immune system, that's why the gut were involved and the microbiota was involved. And then obviously chemicals such as food preservatives, dyes, and also colorings and any preservative that were used to keep foods for longer period and to give them good taste or good colors and so on. But then also electromagnetic field were involved in this, and we had to also take into consideration these situations. And then when we start talking about genetics, we were a little bit, upset about this because everything were new studies and we didn't know much about. And so genetics, when they came in aid us to do a better job, we found that everything was genetics. And as Paul told me once, and I memorized that in my mind, very, very focalized that, saying that, of course, we have a fragility, genetic fragility in children with autism, but we cannot say that everything is genetics. Of course, we could also lecture about genetics and autism. We have many genes involved in many deficiencies and many problems with enzymatic deficiencies and so on, but we will not go into that today, so we'll keep that for other lectures. So all this will, in any case, create problems in our body. And so we found that nutrition, or we should say the correct nutrition, is fundamental in the prevention of symptoms and must be the first therapeutic approach in any disease. So many years of studies and researches enabled us to understand and explain many variables which link nutrition and the maintenance of the state of health of all individuals. The knowledge of mechanisms of biochemical interactions open new fields of studies and research in this science, so the science of nutrition and whatever it's connected. So the basic principles, as we say in clinical nutrition, is that some diseases can be caused or triggered by environmental factors. Many diseases can be cured by the elimination of these factors when it's possible to eliminate. Sometimes we adapt, we don't eliminate. Individual predisposition must be evaluated always. And in the diseases, environmental factors include not only foods, but also preservatives, chemicals present in the air and water. And obviously, we must understand better what's going on in the gut flora and the intestinal environment. So in any disease, we must always remove the chemicals or the toxics and repair possible chronic damages in particularly sensitive organisms which are exposed or inflamed. So it's not enough to eliminate. We also must repair tissues which are damaged or inflamed. So the secret is here is to cure inflammation, general inflammation. So some of our fathers, I would say, one of them, which I met, I had the honor to meet in 1980s in England, was Theron Randolph. And he was one of my teachers for many, many years, which taught about what the environment caused and what nutrition caused in many diseases. Also, we had some works that were published in many years ago, as you see here, dated 1922. Shannon wrote about neuropathic manifestations in infants and children as a result of anaphylactic reactions to foods contained in their dietary life. Also, Albert Rowe in 1944, he was talking about the elimination diet and the patient's allergies, and Rinkel with the rotation diet, which they said you must rotate your diets, you must rotate your foods every day, not accumulate them, not every day. Once we had seasons where some foods were present, some seasons were not present. So nature was taking care of us in this way. Today, seasons are gone, as you can see all over the world, and the changes that we are going across will make this not possible anymore. We are very, very habituary to eat the same things every day, so we get used to some of these foods. Richard Mackness was a clinical ecologist, which he studied medicine in a different way. So he was a psychiatrist. And in England, he brought what he learned with Randolph in America. And obviously, he was one of the first in Europe to speak about the influence of environment on many, many the neuropathic diseases. And again, pioneers in clinical ecology, contemporary, not anymore, Bill Rare in Dallas, which I visited many times in this environmental clinic. He cured many diseases, multiple chemical sensitivities in his clinic. And he also gave us some very good advice on how to treat our patients, which today we don't even know what to do. And many times I send my patients to Dallas. And Doris Rapp, a pediatric specialist, which gave us many important information about chemicals and what they do in our neurons and in our children mostly, and in school. So we had to understand what we're talking about when we speak about food adverse reactions. Many talk about allergies. We see patients every day, they say, I'm allergic to everything. I'm allergic to this, I'm allergic to that. They don't know many times what they are saying, because food allergy is a very specific type of reaction. It's an immediate reaction. Many antibodies are involved, the IgE-mediated phenomena. So you eat strawberries, you have a rash in your face. That's a cause-effect mechanism. You may have asthma, you may have urticaria, you may have anaphylactic shock. That's allergy, and it's very dangerous for many people and for many children. Then we talk about pseudoallergy when we talk about enzymatic deficiency, the lactose intolerance, malabsorption, favism, nickel intolerance, celiac disease. They're not allergies, they're something else. So we must investigate better when we are facing this type of problems. Then we have hypersensitivity foods, which release histamine, like chocolate, dried fruits, seasoned cheese, tyramine also, like histamine, can cause a reaction of our body. So many times we're not allergic to these foods. We're just hypersensitive because we're allergic. We have lots of histamine in our system, and this will be released by the eosinophils, the white cells, which release into the bloodstream, and we have anaphylactic shock. And then we have toxic reactions to mushroom, poisoning, botulism, and so on. Food intolerance is a particular type of reaction of our body. It's a retarded reaction, not IgE-mediated. So a cell-mediated reaction, a retarded reaction, up to 72 hours, 3 days later. You eat something today, you may react 2 days to 3 days later, and you think it's not the last food you have eaten because you eaten that 2 or 3 days before. So what this causes is a chronic inflammation in all our body. So inflammation is a really matter of life and death. It is an abnormal response of a living tissue in relation to an insult or injury. It keeps us alive, protecting us by destroying bacteria, yeast, and viruses, but it can kill us, destroying organs and tissues of our body, the entire body. So inflammation may occur differently in different people with symptoms caused by external inflammatory reactions. Edema of the hearts, osteoarthritis, rheumatoid arthritis, sore throat, gastric paralysis, skin pruritus, rhinitis, irritable bowel syndrome, migraine, headache, type 1 diabetes. So we can have many tissues involved at the same time contemporarily, or just single tissue which react at different times. So we may have a polysymptomatic person which may be triggered, this symptom may be triggered by a single food maybe, or something that we may be intolerant to. So inflammation is also related to depression, lethargy, chronic inflammation, cancer, atherosclerosis, heart diseases, ictus, Alzheimer's disease, type 2 diabetes, obesity. It's a big problem, and it's a world problem which we try to face every day, because maybe 3/4 of the population is overweighted or obese. And we have to also think about what to do with obesity. And it's not nutrition. Many times it's more than that. It could be chronic inflammation, which can cause obesity. So if we identify the causes that trigger inflammation, we can modify these factors and control inflammatory diseases by eliminating or reducing the individual risks for the development of an enormity of related symptoms. Inflammation involves hundreds of biological and chemical processes that have different effects on any organ. So many times our genes can cause an overreaction of our immune system by triggering autoimmune disorders in the family. Often this chronicity persists for a short-circuit mechanism triggered by external environment factors. So some persons study about the stress, and the person who coordinated the word stress is Anseli. And you can see here, it's a non-specific response of the body to a negative stimuli. So anything could be a stimuli for our immune system. So he created the term of general adaptation syndrome. And this theory says that whatever is a stress agent, could be foods, chemicals, allergens, injuries, physical or psychological trauma, the body's response is divided in three phases. The alarm phase, the adaptation phase, in which the body maintains a certain balance with the stressful agent, could be even last years, and the phase of excursion, resulting in the appearance of symptoms and illness. That's when we see the patient usually, because he doesn't know where to go, which specialist he must consult, because he has so many problems that he consults many specialists. And so if we represent our body as a big barrel like this, and which the function of the immune system is already depends from the age, the sex, and the genetic factors, and we put into the barrel many types of stressors: environmental stress, chemical stress, stress from the infection agency, psychological and social stress, and also physical stress and hormonal stress. But all this will fill up the barrel. But we must take into consideration what not every professional does. It's the nutritional triggering factors. For nutrition, we saw before, it could be also chemicals, could be obviously what we eat every day, and dietary treatments. So this will cause what? It will cause that we have a food, or we develop a food or chemical intolerance. That's when we have symptoms and diseases, when our barrel is full. So we must take into consideration all the stresses that you see here on the line, and maybe we can avoid some of them, but some of them we cannot avoid, so we adapt. But our body is capable to adapt itself to many stressors, but we must avoid many of them that we can avoid. And nutrition is the best thing to start from. So controversies among doctors are that in traditional medicine, we should say conventional medicine, if a person is sick, he needs to introduce chemicals into the body to cure that. Clinical ecology, if a person is sick, he needs to remove chemicals from the body. But complementary medicine, which is more appropriate, if a person is ill, there are specific indications for taking chemical substances and specific indications to remove them from their body. So we must always have a 360-degree view of the problem. And when we speak about food intolerance, as I said before, many patients come to our attention and say, I'm allergic, I'm intolerant. Maybe they have enzymatic deficiency, they have lactose deficiency, or celiac disease, or something else. We must have the medical history. The first thing we must spend time on is the medical history of the patient, which many of us don't do anymore. We don't spend 20 minutes to make a good medical history. So we must do that and see also the family history, the physiological history, and so on. And so we must define what we mean for food intolerance. It's a condition characterized by inability to absorb or metabolize a nutrient. It's an abnormal reaction of the body to a specific food. It's allergy or intolerance. Well, we have a classification for this, for food adverse reactions. It could be immunomediated, as I said, food allergy, because we have many IgEs, many antibodies are involved, and non-immunomediated, where we're talking about food intolerance. But the use of terms immunomediated to indicate allergies and non-immunomediated to indicate intolerance is not really appropriate. Food intolerance is still an immunity hypersensitivity reaction. It is just, it does not depend only on the IgE. So these two phenomena, often one leads into the other as expression of an hyperreactivity of our immune system. So we see here on the two sides, food allergy is an immediate reaction. Strawberries, angioedema from shellfish or peanuts. It's an acute reaction. It is dose-dependent, IgE-mediated, no cross-reactivity always, and it's defined target organs. The mucosa usually, nose, ears, eyes, and also the lungs and the skin. In food intolerance, there's a retarded reaction up to 72 hours after the injection, the eating the food, chronic reaction, no dose dependent. Even small doses can hyperreact our body. Not IgE mediated, no cross-reactivity, cross-reactivity in more than 70-80% of cases. If we avoid one food, we must avoid the whole food family for some time. And to regain tolerance, any end organ or apparatus can be involved. So we can have the skin, the gut, and the brain contemporarily at the same time, which are inflamed, and we can have many symptoms on these organs. Jonathan Brossoff, professor of allergy and environmental health, King's College in London, studied the macromolecule theory, which obviously involves the gut. And what he says that the theory of the altered absorption of macromolecules are due to the intestinal barrier, which rules a fundamental function in absorption of foods and stimulating immune system. More than 60% of all immunity cells are close to the intestinal walls. On the intestinal barrier, there are numerous saprophyte cells, the bacterial flora, saprophyte. An alteration of bacterial flora is called intestinal dysbiosis, dysmicrobism, as we can say. So the bacteria colonize the intestine from birth are about more than 1,000 species, Acidophilus, Bifidus, Escherichia coli, Enterococcus, and so on. What they do? They synthesize vitamins, B, K, and so on, folic acid, pantothenic acid, metabolize steroid hormones, regulate intestinal gas, produce natural antibiotics, and also produce antibacterial action substances. So it's not that we eliminate the bacteria and we are safe. No, we need them. We cannot live without them. If we avoid the Escherichia coli, E. coli, we cannot live. Our life is impossible. So we need them. But we have a culture of Escherichia coli, we must treat with antibiotics. But we also must culture our gut bacteria and restore our gut bacteria. So we have two parts of the intestinal barrier, the non-immunologic part and the immunologic part. And you can see that the non-immunological intestinal barrier contains two sides, the intestinal epithelium, the pile of binded enterocytes, atypical tight junctions. Normally, this barrier is little or totally impenetrable to potential dangerous material. Any alteration or inflammation can alter its permeability. The other part, the juxtamucosal environment, is the mucus is the fundamental component of the barrier. When we say that we mucus in the feces, it's normal. We have that. We must have that. It traps microorganisms and other dangerous materials, blocking it as its absorption. Contains secretory IgA. Many people don't produce IgA. They have low immunity response. Enzyme for digestion of proteins, fats, and anaerobic bacteria normally present on the mucosa. So the mucosa immune system is gut-associated organized lymphoid tissues. It's the gut. It's almost 90% of the malt, the total amount of our immune system. So in this big area of our gastrointestinal area, we estimate more than 400 square meters, taking about meters or yards or whatever we can take into consideration. We have these bacteria, these saprophytes bacteria, which are there. They must be there. The alteration of the intestinal barrier increases the gut permeability. And when the intestine loses its filter capacity, it can permit the transit of macromolecules that, being recognized as non-self, as Brostov says, activate the body mechanism of defense. So it's non-self mechanism that makes our immune system react. So what causes the alteration of the intestinal barrier? You can see here in this slide many possible causes that trigger that. Genetic conditions, enteritis, diarrhea, prolonged steroid therapy. We many times use steroid for almost everything, but not always we need them. Prolonged antibiotic therapy, especially if they're not aimed to cure that type of bacteria. Viral infections, why we use antibiotics for viral infections, I don't know. Surgery, and also emotional stress. So this will lead also to food intolerance. So from one side, the accumulation, the fact that we use always the same foods, we repeat the same foods, and the other condition is when we have the damage of our absorbance area, so our gut. So food intolerance is a condition in which food is avoided and the symptoms disappear. It's like a miracle, but it's not a miracle. It's just like that. So when we take away, we avoid the food, we must consider the cross reactions that we have within the foods of the same family. And so we must be very careful to avoid the whole biological family. The ingestion of a collateral food means not to detox the body and keep the intolerance longer and longer. So we don't recover from that. So these are some examples of food families, the biological families. If we avoid wheat, we must avoid oat, corn, barley, and rice. If we avoid milk, we also avoid beef and lamb. Eggs, we avoid chicken, cockerel, guinea fowl, and so on. Tomato, we avoid potatoes, peppers, eggplants. The Solanacea family, and so we go on and on seeing all the families. You can see them anywhere. Also in India, you can consult the Graminaceae, the Rosaceae family. So you can see between the biological families which cross-react between them. So we avoid the whole family for the period of time that we set up for the detoxification period. And so I go on this without losing some time. So what food intolerance disturbs are not only in relation to direct ingestion, it may last at a distance of 72 hours later, so up to 72 hours. So not being a cause-effect mechanism, sometimes we mislead the diagnosis because we think that the person tells us every time I eat that food, I'm sick. It's not like that. It's what you accumulate, what you have inflamed before. It can manifest with symptoms and diseases at the expense of any organ, apparatus, or system. And after the period of a recommended avoidance, the substance can be reintroduced into the diet every 3 or 4 days. So we just wait enough long time to start again, and so we can regain tolerance a little bit at a time. Like when we use with children, as soon as they are born, they don't tolerate the vaccine milk, and we avoid the milk, and then cow's milk, and then we can reintroduce it back into their life a little bit at a time when they are a little bit grown up, maybe after the year of age and so on. And so they may tolerate it. Here on this slide, you can see that any organ could be aim of an infection. So you can see the central nervous system, the genitourinary tract, respiratory tract, skeletal muscle, gastrointestinal tract, and also the skin, obviously. So that we have many diseases or symptoms connected to to nutrition and to inflammation in general. Here you can see the chronic inflammation and the intestinal microbiota, which can affect almost any organ. So what is intestinal microbiota? Billions of bacterial cells which reside in our intestinal tract and are one of the richest and most complex ecosystems on the planet. The largest and most complex bacterial ecosystem of the human body, for 75–80% are not cultivable. So we have a percentage of Firmicutes, Bacteroides, Actinobacteria, Proteobacteria, Methanobrevibacter simiti, Candida, Penicillium aspergillus. So that can cause any metabolic disorder in our body. When we prescribe a diet, we always take into consideration what's going on in our gut and in our microbiota, how we treat it. The microbiota changes in life. In life stages, it will change. You can see here from the child, the grown-up, the adult, and the elderly. And the intestinal microbiota is gradually assembled thanks to the perinatal events, feeding with the breast milk, contact with the bacteria present in the mother's body. So it's also the way you come to your birth will affect your microbiota, obviously. In infant, there's a high abundance of bifidobacterium, which is crucial for development and education of the immune system, protection from infection by prevention of onset of allergic diseases, asthma, eczema, and so on. The microbiota slowly assumes the typical conformation of a healthy adult's microbiota, and the balance of the intestinal microbiota helps to prevent the onset of diseases that may persist throughout the life: obesity, diabetes, metabolic disorders. In adult life, an healthy intestinal microbiota permits to preserve the immune system balance, preserve the balance of the energy metabolism, prevent many local or systemic diseases, and preserve the body's defense even in stressful situations, travel, environmental changes, or lifestyle changes. In the elderly, a healthy microbiota helps to maintain proper nutritional status, balance the function of the immune system again, and counteract the effects of aging, immunosenescence, chronic and generalized inflammation. Know your intestinal microbiota for preventing many intestinal diseases or systemic diseases, design personalized dietary approaches, and maintaining the balance of the organism in every change of life, pregnancy, menopause, and stressful situations. Metabolic function of intestinal microbiota also are obviously important for vitamin production, amino acid synthesis, biotransformation of the bile acids, and fermentation of non-digestible mucoendogenous substrates. Here you can see the population according to which part of our gastrointestinal part we are. So the distribution of the microbiota, obviously even in the stomach, in the lung, in the vagina, we have the microflora everywhere in our body and also on the skin. So when we speak about dysbiosis, we talk about changes in the balance of the microbiota in the gut system. So we can have intestinal pathologies and metabolic syndrome. The relationship between microbiota and metabolic syndrome involves the relative risk of developing diabetes type 2, cardiovascular diseases, hyperglycemia, hyperlipidemia, insulin resistance, fibrinolysis, liver diseases, and non-alcoholic fatty liver disease. In metabolic syndrome and the obese, high-fat diet causes increase in firmicutes and decrease in bacteroides, increased glycoalkylase and phosphotransferase enzymes, which increase in fermentation products starting from polysaccharides, acetate, butyrate, and propionate, which have a high energy value for enterocytes and increase caloric intake. The microbiota connect on intestinal enzymes involved in lipogenesis by increasing the deposition of fat in the liver, steatosis, on the composition of the bile, on the choline levels, and on the permeability of the mucous membrane. Specifically, in microbiota in autism, we say that individuals with autism have a unique intestinal bacterial population responsible for the variety and severity of symptoms. We have conducted many years ago with Professor Federico Balzola in the Molinette Institute of the hospital in Turin, and I'm glad Paul Shattuck is present. He knows very well Federico Balzola, and also when we did this in Turin, and we had a big population of children in this hospital. And since the beginning of the outpatient activity in 2005, more than 900 patients have come to our observation who presented gastrointestinal symptoms, autism spectrum neuropsychiatric pathologies. All of them were prescribed first-level exams, which included blood tests, obviously malabsorption, HLA mutation for celiac disease, feces, parasitological, fecal hemoglobin, mycological, fecal calprotectin, and abdominal intestinal ultrasound in many of them. Bowel endoscopy nutrition underwent endoscopy in many of them, and also we used at the time a video capsule, pediatric shape video capsule in selected cases. We had 201 total patients with pervasive developmental disorders, 169 male and 32 females, in average 12 years of age. The key symptoms were 48% constipation, 28% diarrhea, 55% abdominal pain, and 10% gastroesophageal reflux. And obviously, inflammatory index were stated in 40%, celiac disease antibodies negative 90%, 20% malabsorption, malnutrition 88%, and also hemoglobin feces positive for 7%. Calprotectin in 48%, HLA, DQ2 and DQ8 plus 55%, iron deficiency anemia in 25%, and macrocythemia in 40%. Low IgA in 35%, high IgE in 40%, and atopy in 80% with specific IgE, negative 90%. And we had some histological findings in this. 62 out of 190 esophagitis, chronic gastritis, eosinophilic gastritis, MASH1 and 2 present, non-irritable bowel syndrome, chronic colitis, colitis with excess eosinophils, and video capsule with signs of atypical irritable bowel syndrome, 19 out of 25. And based on the histological data, was started the pharmacological therapy with mesalazine, budesonide, beclomethasone, immunosuppressants, and anti-TNF, gluten and casein-free diet, and gel drug therapy, different according to the patient that we had. At the 12 months follow-up of 150 patients, we had improvement, gastrointestinal improvement in 65%, which was pain, 85% of bowel complaints, 41% reflux and dysphagia, 40% improved muscle mass growth. And also 36 patients followed up to 12 months at behavioral improvement, 65% hyperactivity and aggression, 35% attention disorder, and 22.1 sleep and wake rhythm. In a sample of 2,973 children with ASD, experienced at least one type of chronic GI problem, constipation, abdominal pain, bloating, diarrhea, and also nausea, lasting 3 or more months. Children with each type of gastrointestinal problem had significant high rates of both anxiety and sensory overresponsivity. Sensory overresponsivity and anxiety were highly associated, and each provided unique contributions to the prediction of chronic GI problems in logistic regression analysis. The results indicate that anxiety, sensory overresponsivity, and GI problems are possibly interrelated phenomena for children with ASD. and may have common underlying mechanisms. And this was published in 2012 and 13. Here, this was published in Canada, which examined the role of enteric fatty acid, short-chain fatty acid, specifically propionic acid, which is produced by bacteria that have been associated with the autistic condition and which may play a role in the etiology of some forms of ASD. This was mid-phase in 2013. Which implications are for clinical practice? Being able to intervene effectively on the most important cardiovascular risk factors, prevent and control type 2 diabetes more effectively, and treat and prevent obesity, intervening with lifestyle and nutraceutic diet. So, as conclusion, the development of research and absolutely innovative knowledge in the field of the microbiota will involve in the future not only gastroenterologists, but also internists, cardiologists, allergists, psychiatrists, veterinarians, and other specialists who will find in this environment a strong and decisive ally for the prevention and the treatment of many, many pathologic conditions. Thank you for your attention. I think I've been in time in these 38 to 40 minutes. So we have enough time also to answer some of the questions. I'm sorry we cannot go deep into the matter because we need more and more longer time to expose many of these facts. But I think that with the cooperation of all the specialists I cited in the lecture, I'm sure that we can get there and help not only parents, but also therapists and teachers and also professionals to do a better job. So the first approach is nutrition and also the intestinal gut flora. Thank you very much. Okay. J.N. Nambi says, is there a standard test to compare microbiota of ASD against normal microbiota? It's the same microbiota test that we can achieve. It's not different than in ASD patients, and the results are different. ASD children patients have some different microbiota. There is a change. There is a difference. Microbiota. Does C-section birth impact infant's development of healthy microbiota? When people were talking about the fecal transplantation between people, children and parents of the same family, they thought this was true and they had to have the same family. Then they found that if the child is adopted, it will develop the same microbiota of the parents who are growing them. So the microbiota will change. It can change. So you have the original, but it may change in life according to your environment. So this can change. Is there a test that connects migraines to the food intolerance or GI issues? No, if you do, I do cytotoxic testing for the food intolerance and avoid the foods I found positive. And 85% of migraines are due to food intolerance, and avoid those foods. And maybe I would say totally, but more than 70–80% of these people will benefit from, they will recover from the migraine. This is very important. And obviously, when you avoid the food, you always go to restore your gut flora. Always. I don't leave that out. I always achieve both of them. Have you heard of James Adams? Of course, we are friends with James. We met recently in Abu Dhabi and spoke about microbiota transfer treatment, which he's doing in Arizona. And I don't think we don't have enough data to claim that this could be true. We were thinking to do that in Italy at the Children's Hospital in Rome, at the Bambino Gesù, with the experts there. But we never started because even the law inhibits this practice to do, and it equals to any organ transplantation. It's too difficult to achieve. And I don't know how much benefit we could get from this in ASD patients. We had many requests, but we never started doing this. I want to thank Vladimir Trajkovsky, another good friend, for these congratulations. And I hope to see you very, very shortly in Macedonia and maybe elsewhere. Why not? Thank you, Vladimir. The children with autism always need a gluten and dairy-free diet, even if the test negative of this intolerance. No, I spoke with Paul Shutter many times of this, and I said, of course, you can avoid the gluten and dairy products for a period of time, but you don't stick for life to this diet, and maybe take into consideration that maybe you can use, you can avoid other foods, and not necessarily gluten and milk and dairy products. So it's individual. You can go on for a period without gluten and casein, but then you recover from that. You put the foods on rotation again. Is there a link between gluten intolerance and anemia? Well, we have seen this in celiac patients, but not in gluten intolerance. In celiac patients, yes, because as you know, we may have gluten intolerance in non-celiac patients. And in Italy, we have a high percentage of these cases. Maybe 3% or 4% of population may suffer from gluten intolerance and they're not celiac. And many times it would be, maybe doing some extra tests for this would be okay. Like the mucosal oral patch test for gluten. We have adopted this method in Italy. It was a trademark from scientists, gastroenterologists, and dermatologists, and we are getting good results in avoiding the gluten in these patients who are positive to the gluten mucosal oral patch test for gluten and nickel. We do both for this. I can get your child eat a variety of foods, which I believe you said very important. If your child is picky eater, due to sensory tissues with smell and texture. Well, food selectivity in children, especially ASD children, is very, very important. And I think you must be very careful to substitute the foods you avoid with the foods which have very similar smell, color, and consistency. Also, make the children touch the food, and also involve them. When you cook them, you prepare them. Maybe this will help to substitute some of the foods you're the addict to. And so if a child always is addict to a food, it's very, very dangerous, because it means that he could have an intolerance to that. Sometimes the child avoids the food. Many times the child doesn't want that food. That's also important, because it means that the child doesn't tolerate that food. If you insist and the parent insists, or the therapist insists, you may cause intolerance, because you are forcing the child, and he has a defense. He doesn't want it because he doesn't tolerate. If you insist, he may eat it, and then he may be addict to that again, and he have an intolerance, and he gets inflammation out of that. So be careful when you substitute the foods, to substitute with the foods who have the same characteristics. How can you get your child eat the right? Okay, that's I said. Can you heal intolerance, and which therapies? Well, the avoidance is the best thing to do. Avoid the foods that you think, you found intolerant. You can also do immunotherapy. You can also desensitize. I've been using EPD for this, low dose desensitization for foods, and I've been very successful in this, not only for airborne allergens, but also food allergies and food intolerance also. When you don't recover from an intolerance, too long time of avoidance, it doesn't pay. The more you avoid the food, the more sensitive you become. So you must reintroduce back the foods into the diet, little bit at a time, and every 4 days, maybe every week, once a week, not every 4 days necessarily. So you try again. And so you challenge the food into the diet. With the desensitization, with EPD, enzyme potentiated desensitization, you may succeed better, and no risk, no side effects at all. And I've been using it for many, many years. I can claim to have done more than 40,000 shots of EPD altogether, foods and inhalants. And I had more than 90% of success in treating allergies and also intolerance. Okay, again, we can hear you. Yeah, you can hear me. What else? That's it. And what are recommendations for gluten casein-free diet and nutrition who are sensitive due to sensory issues? 3 types of food only containing gluten. Well, gluten is a big problem, and we have 1% of our population, 600,000 people in Italy, who suffer from gluten, from celiac disease. And we find restaurants, we found all sorts of foods without gluten, and sometimes it's a problem. But lately, the past 10 years, I think we have overcome them because we are finding new solutions for without gluten. And there are some studies also to produce no grains without gluten, and research is going on. I hope we won't have to wait a long time to have this done, and we hope that this can become true. I mean, these studies can go on. Will be okay. Activia and probiotics. Well, be careful when we use the probiotics. We need many types. So you saw the families that I showed before, the Firmicutes, Filia, and so on. We must use many families of these probiotics. That is why sometimes when we do microbiota and all the list of bacteria that we have in the gut, then we cannot give them a therapy for all specific bacteria. You must give them the precursors of probiotics and the most important one, the one who will attach in our gut mucosa and will reproduce. So be careful and have more bacteria, more probiotics, not all one type. And be careful from what they are derived from. Not all of them are cultivated on milk. We also have some other terrain of culture that we can use. For new grains, yes, we look for new grains. We like to eat activia for the probiotics, also keto bread made from wheat. Well, when we talk about that, we also must consider the countries we are in. When we are in Arabic countries, obviously they talk about their own foods. When we talk about Russia people, they have another type of meals and foods. In Europe, we have different. In America, we have different. South America are different. In Africa are different. So we also must consider where we are, which children we're talking about, what population we are in. And so we must choose the foods of that area and see that we don't become intolerant. I said before, if we become intolerant, we become intolerant to the foods we eat. And maybe we eat too much, too often. So just dilute the foods in time, not every day, and maybe not every other day. So you must study the child and also study the type of foods you're using. Be okay to eat, okay? Sorry, I mean gluten-free diet. Well, I don't understand. If we avoid gluten and milk, totally, it's something. If we want to use only wheat and not casein, it's a different thing. Depends on what we want to have. But we must prescribe a diet. So we must take into consideration all of these, but not focalized only on milk and grain. We must also have other foods. Today we have pasta made out of lentils, made out of chickpeas, made out of soy and so on. So utilize also legumes to have flour to make bread and to make pasta or pizza. We can have this. We're using this. Sourdough bread. We have lots of flour with yeast. And so that's why we have sourdough bread, and it feels okay. If we don't use yeast, common yeast, it's better. We avoid it many times. 80% of times we avoid yeast. But we use sourdough bread with some safety regularly, and it's well tolerated. So we may use that. Foods that should be avoided together in our diet, and not just as these patients to avoid chronic immunology. Yes, everyone has his own diet. That is why we must take into consideration not only ASD. I treat ASD children like any other normal child. If especially, it's just that ASD children have special needs respect to a normal child. But we take into consideration whether it's an ASD patient or not ASD patient. It could be anybody who has chronic inflammation. That is why we must recover from that. We know that foods eaten every day may cause chronic inflammation. So we must avoid that. See from outside that indicate that the child is eating to a food without doing an intolerance. No, you can just do the avoidance diet, the elimination diet, like they did in America 1950s, 1960s. but it has to be projected correctly. Because if you don't take into consideration the food families, then you fail. That is why you need to know the food family, the botanical families, because you avoid apples and you eat peach, or you eat rosacea family, you don't succeed in making a good diagnosis. The gold standard to make a good diagnosis is the elimination diet. But you must eliminate the correct foods, thinking about the food families. Randolph was doing the fasting, 4-day fasting diet, and then he was introducing one food family at a time. It took a long period of time, and not every patient could do that. But Macanes did it for his psychiatric patients, and he succeeded. It depends who you have in front of you, who you're talking about. A child is not easy to treat, so you must take into consideration many items, and also in which family is living and who's cooperating with his diet at home, in school, and so on. Like Doris Rapp was saying, a good guide is for teachers, but also for parents. If you do everything okay at home and not in school, or vice versa, you don't obtain any good symptom, any good results. So as I said, you don't need to do necessarily a blood test. Cytotoxic test was abandoned for many years. In America, was abandoned totally, as lots of adverse criteria of results. But we have performed good work on it, and now we have artificial intelligence for the reading. It's not subjective. It's a sort of automized way to diagnose the food intolerance with the blood test. And you only need a very tiny bit of blood. Not IgG, of course. We do not calculating any IgGs, any antibodies. It's just a physical test. It's qualitative, not quantitative. So the white cells who are damaged by the food or the chemicals could influence your inflammation status. So this is very important. This is work done. So this was, well, Mariesa Aldama, if he has higher than normal the eosinophils, this is a state that has high histamine, and so you must check also the IgEs, because the IgEs would mean that he could have an allergy beside having intolerance. So check also for the allergy. We must do that. Okay. Of course, also, I want to answer to many of the colleagues who are writing. You have my email, and thanks also to ARI Institute, if they want to pass me specific questions, which I may answer even in writings, because obviously the narrow period of time that we have at our disposal does not permit me to answer you in fully, and maybe some things are not well exposed, also for the language and the rush that we have. In Italy now it's 8 o'clock in the evening, and so I think you can write any questions you may have in private or through the our institute. I would be very happy to answer, and even after this meeting, and maybe to clarify also specific things, and also the testing, and also what I think about the microbiota and the approach that we are utilizing every day. You can see that we had many studies done for a long period of time. Obviously, the variety of people that we have seen, and not only children, also adults, and also Asperger, and also other types of ADHD, which we face every day, these children in school. And so my aim is to teach also teachers to be more careful and to find which are the signs that can indicate that the child needs help. You don't send them always to the psychologist because the child is not very, very present in school, and it's not learning well properly because maybe he's allergic to molds or dust mites, or maybe is intolerant to some daily foods which affect his brain. So be careful when we are these signs of allergies. Well, you know, to answer this this colleague on ulcerative colitis, obviously that's an autoimmune disease. So we don't know how much the nutrition could help in this, but I had many patients with ulcerative colitis, adults, and also children, and the diet is fundamental. It's important, but it's not the cause. It might be a triggering item. So avoid that. Maybe that will help. It's not only mesalazine or steroids that help this type of disease. And then also there are other types of therapies involved, like psychotherapy and so on. So it's very important to have a good medical history, and then we can study better also the answer to this. Avoiding food intolerance children who have no symptoms other than a positive intolerance test. No, but in any case, when we avoid the food, it's for a period of time. It's not allergy. You don't have a memory of that, but you avoid that food to desensitize the person. It's like doing a desensitization, like a vaccine in this case. So you create tolerance. It's not that you will empty the barrel I showed before fully, but even halfway does the difference. So it's important to avoid what you think every day can affect you and can inflame your tissues. Then you start again, you trigger them again. So you can reintroduce the test into the diet the foods you have avoided. It's not long, maybe 4 months time, 6 weeks, 8 weeks, I don't know. You must check also in the follow-up of the child. Yes, I agree with Roland about Lactobacillus reuteri. It's one of the lactobacillus. You know, the 5 big families of Lactobacillus and bifidum bacteria are very important to restore the gut flora. So not only that bacteria, the gut flora, but also others. So you must always more than one, more than even 10. I usually do one day one group, second day another group, and maybe even the third day another group. If you cannot give them all together. But these are all important. So you must take into consideration the utilization of more types of gut flora. Many companies produce many gut flora preparations. Obviously, you must put them together and rotate them, because we have all of them inside our body. And so we cannot live without them. You must restore this imbalance so that it will not fermentate. An old professor of gastroenterology told me once, remember that from the smell of your fart, from your gas, your intestinal gas, you can understand what's the problem. So maybe it's methane, it stinks. Maybe it's just noisy and doesn't stink. It's hydrogen, CO2. So it's not all the same gas. So you also know where you are in your gut, maybe on the right side, on the left side, or the transversal side of your gut. So different bacteria will live in different types, in different areas of our gut. So it's important also from the gas that you smell, what you see, what comes out of that. Low-dose allergen therapy in Europe. Well, we do it in Italy, we do it in England. The low-dose desensitization, the EPD, thanks to Professor McEwen, which left us some years ago, and I still do that, and I get this therapy. And many other colleagues in Italy, in Belgium, in Germany, in Albania, even in Moscow now, and in England, which utilize this therapy. And also, I believe in the United States, you can use the low-dose desensitization for many of these type of reactions. So it can be used. In Europe, we do it anywhere. But if you contact me, I can give you the contacts of doctors who utilize this type of therapy. A lot of weight when he suddenly eats foods that contain gluten and casein, even though he has good balanced diet. Yes, but if he gets inflammation from gluten and casein, obviously has malabsorption. So the tight junctions of the intestine open up. So your intestine has holes inside. So in the bloodstream, you will enter the famous non-self proteins, which will damage your absorption. So you get malnutrition out of that. So be careful if you have inflammation of this type. Intolerance. No supplements, just diet. Supplements if you need them. Remember that many supplements are one against the other, antagonistic. Some are agonistic. So if you have an excess of one, you will load down the others. So be careful in utilizing vitamins, minerals. You don't need them always. Many times you may need them, but you must check for that if there's a need for them. Well, be careful with sauerkraut and yeast because there's fermentation, there's vinegar, and there is other types of yeast there that may inflame you more and more. So you get inflamed and maybe also malabsorption. So be careful with the acid and sauerkraut in particular. What do you mean about casomorphine and glutamorphine? We know this. It's not a theory. It's real life. We have been experimented a diet without the gluten and milk and dairy products, and we had immediately sudden improvement of interrelation with children and also the reaction. But then you didn't get any better, so we had to stop and maybe change things because there were other things involved. That's why we agreed also with Paul, Porchat, we spoke many times about this. And of course, we take that into consideration. It's part of it, but it's not only that. We also take into consideration everyday nutrition. So that's what the secret is. Not IgG. Forget about IgG. We don't have, because many allergists utilize IgE for allergy, IgG for intolerance. It's not correct. IgG is a specific antibody which you can get in your body as a consequence of any inflammation. So it's not that IgG will tell you that you're intolerant to that food. And the tests that they're using for IgG are not very attendable and they're not reliable. And you may have many false positive. And then it's very hard to give a diet to a child not creating any other problem. So I would be very careful with the IgG testing. No, banana is by itself. It's a food family which is not the same as coconut. So they two food families differently. You can use one day and one the other day without any problem. They don't cross-react. Okay, Frank? I think I'm over here. I don't see any more. But Steve, I think our time is over. But send me any questions I may answer, and more clearly and more, in the minimal parts that I can help. I'm here to help. I'm not here to give any doubts to anybody. I want to give you some certain things, not doubts. So anytime that you may need my presence, I'm here, and I cooperate with Ari all the time you want, and also with the colleagues that I see there. Thanks again to Paul, to Petra, and to Steve, and also to Denise, which organized this beautiful meeting. And I hope we will have many questions. It means that people want us to speak about this and maybe get together and research about this. Thank you very much.
Yeah, well, Carmel, you did a super job. I actually learned a great deal of information. I thought I knew it all already, but now I know I need more to learn. And as you can see, there's a lot of interests in your talk with all the great questions. And again, we appreciate all your support, and you count on us tapping your knowledge base in the future, near and far. But thanks again. And thank you everyone around the world for joining that. Goodbye.
Thank you all. Thank you all. Bye-bye.